Hello, this is Dr. David Green, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today the topic is an overview of failed back surgery syndrome. Well, what is failed back surgery? That's when the outcome of low back surgery fails to provide the desired outcome. And the result ends up being chronic pain, which is termed failed back surgery syndrome, known as FBSS for short. It is one of the most frustrating things a patient can deal with, since he or she went to the trouble to have the surgery, hoping for a pain-free outcome. How big of a problem is it? Well, studies show that up to 40% of all back surgeries fail, and 10% of back surgery patients actually end up worse than where they started. Each additional surgery that is performed has a lower chance of success than the one before. It can be an exceptionally depressing situation. Well, why does failed back surgery occur? There are 5 reasons. One might be surgery was performed for the wrong reason to begin with, and that's the 50% rule. Even the best trained spine doctors are going to misdiagnose where the pain is coming from 50% of the time, and that's just a fact. So the second reason is surgery may have been performed for the appropriate reason, but it just didn't get rid of all the pain. It might have been a technically perfectly performed surgery. So here on the right you have hardware that was put in place for scoliosis situation. The hardware looks fine. You know, the spine's all rotated and difficult, and this looks okay. But it may have been that this person only had half of his or her pain taken care of, and that's just a fact of the limitations of modern spine surgery. Is the 50% going to be enough? Is that person going to be happy a year or two later, or are they going to be miserable? So it's unclear. The patient has expectations. They may not be met. A third reason might be the surgery was just not done well. Screws might have been misplaced. Just technically it was not a good job, and the person might have residual pain as a result of that. Next reason would be that the fusion doesn't occur and the hardware might break. Now, this might be anything from the hardware was placed great, the surgery was done well, maybe the individual started smoking again after surgery and it inhibited the fusion. So that may happen. And the fifth reason would be that the outcome might have been satisfactory initially, but then scar tissue forms around nerve roots, could be painful hardware, or it could be degeneration of the adjacent segments. And that's shown here. You have hardware that was placed very nicely. There's a cross connector. But look at the level above. This is so degenerative. There's like no disc space at all. Here you have a nice disc space. Here you have a nice disc space, but the level right above the fusion, it's very degenerative. You actually have a huge bone spur that's connecting these two levels. So that can create a lot of pain. Now, what are the symptoms? It's going to vary depending on what the issue is, but it could be daily back pain that may radiate into the flank or the buttock area, spasms and aching. A person may end up with leg pain and burning from sciatica, depending on whether scar tissue formed around nerve roots or you have maybe a disc herniation at the level above. Well, what are the treatment options for failed back? One, the person should always have a surgical evaluation to see if a revision would be necessary for a broken hardware or an adjacent level fracture or something like that. But if that's not indicated, then physical therapy and chiropractic treatment can be very beneficial. This can include modalities such as ultrasound, electrical stimulation. Spinal decompression therapy is an excellent treatment. It's contraindicated, though, if there's hardware in place, like screws and rods. Acupuncture can be very helpful, along with medication management. Now, this may include nonsteroidal anti-inflammatories, either oral or topical. It could also include neuropathic medications such as Neurontin or Lyrica, or it may include long-term narcotic medications. There are indications for failed back surgery when a person might benefit from chronic narcotic treatment. Here are some interventional treatments. Trigger point injections might work very well for spasms and aching. Hardware injections to see if the hardware is a source of pain can be helpful, and that you'll know right away. Pain doctor puts numbing medicine around the hardware, should be able to tell if relief comes quickly. Facet or medial branch blocks. This is a view of the back of the spine. This are the facet joints on either side. So let's say you have a fusion up here and this is an adjacent segment degeneration. A pain doctor can put numbing medicine around these little nerve endings, or medicine can go right into the facet joint of steroid, and you can get a lot of pain relief for months that way. Epidural injections can be helpful if there's nerve root compression. And radiofrequency ablation is what's shown here, where a catheter is put in. This area is heated up with thermocoagulation energy, heat energy, and it deadens these nerve endings, and that can give long-term pain relief for over a year. Spinal cord stimulator implant is an excellent last resort option. If all else fails, this implant has been revolutionary for failed back. It continues to get better and better. Most of them now have over 200 programming options, which can work very well for both back and leg pain that is occurring. It doesn't cure the problem, but it can be very effective for masking the pain. And it works well, has been shown in over 75% of patients do extremely well with these implants. The top pain management clinics in Nevada are with the Nevada Pain Network. They offer one-stop shop for comprehensive pain management, including board-certified pain doctors, chiropractors, acupuncture, and more. There are over 50 insurances that are accepted at several locations in Las Vegas and Henderson. They've won the Patient's Choice Award 5 years in a row. Amazing. The number to call for scheduling is 702-323-0553. And visit us on the web at painmanagementlasvegas.com. I'm Dr. David Green with the Nevada Pain Network. Your pain stops here.